Welcome to A Sound Constitution with Mahir, Sharon, Katie, and Brandy on 101.7 CHLY Radio.
We are fourth-year nursing students from Vancouver Island University in Nanaimo.
We're here working to demystify health issues in and around your community.
Bringing you evidence-based information about your healthcare options. This information is for educational purposes and does not replace the advice of your primary healthcare provider.
We would like to acknowledge that we are on the traditional territory of the Sinimu First Nations. Hello and welcome to A Sound Constitution. I'm Katie.
And I'm Sharon.
And we're so excited to bring you the next episode in our Listen to Your Body series, the respiratory system.
We'll be discussing what organs are part of the respiratory system, the importance and significance of the system, common diseases and how to take care of it, and how it impacts various parts of your life. We'll also go into more depth about breathing exercises, a little bit about smoking, a little bit about smoking cannabis, and debunking myths.
We do need to take a moment to tell you that although we're very thorough in our research and present you with factual information, we don't replace a licensed medical professional. Don't self-diagnose, change medications, or alter your prescribed health routine in any way based on what we tell you in this episode. If you have concerns related to what we discuss, please speak to your doctor or other healthcare provider.
As we usually do, we went out and interviewed people in the community to see what they already know about the respiratory system and what they need to be more knowledgeable about. Let's take a listen to see what they have to say. Please note that these are the opinions of the people we interviewed and as such may not be supported by facts or research.
Hey you!
Who, me?
Yeah, you! We want to hear what you have to say because
your opinion matters!
What organs are part of the respiratory system?
Your lungs.
The lungs and the esophagus.
La trachée, le pharynx, le larynx.
What's harmful to the respiratory system or lungs?
The air quality, the pollution in the air.
Probably smoke, whether you're smoking it or whether it's burning trees.
Smoking.
Secondhand smoking.
What's the worst thing that can happen to your respiratory system or lungs?
What's the worst that could happen by not smoke weed? Then the pollution will get to you.
Many of the flu viruses, and there's also bacteria.
Well, cancer? Is that the worst one?
Oh, I don't know, but I can tell you I had a pulmonary embolism, so that was pretty major.
How do you care for your respiratory system or lungs?
I smoke weed every day.
I drive a bicycle.
I guess I don't. I hike.
Exercise.
Thanks, Mahir. The people interviewed got the organs right.
Lungs, pharynx, larynx, and the trachea are all a part of the respiratory system. Some more include the mouth, nose, bronchi, and bronchioles, which all are found in the lungs.
Our interviewees also got the factors which affect the respiratory system correct. Air pollutants such as inhaled or secondhand smoke, car pollution, and smoke from burning wood all harm our respiratory system. The amount of exercise you do also affects your lung health. Diseases that affect your immune system, also known as autoimmune diseases, also affect your lungs. If your immune system isn't working right, your lungs are more susceptible to viral and bacterial infections, as well as lung cancer. Prenatal factors, meaning factors that affect you before you're born, also exist. These include not having enough nutrition and if the mother is smoking during pregnancy. Your nutrition as an adult affects your lungs. If you don't eat enough, the lungs will have less self-healing properties and be more prone to infections. If you eat too much and become obese, you're more prone to have asthma and sleep apnea syndrome.
As for the most harmful things that can happen to your respiratory system, some interviewees got it right and some got it wrong. One of the interviewees stated that the most harmful thing you can do to your respiratory system is, and I quote, not smoke weed because then the pollution can get to you, end quote. In other words, that smoking cannabis will protect your lungs. This is a common myth in our society.
Mythbusters!
Many think that the recent studies showing some benefits of cannabis mean that smoking cannabis will be helpful and protective. This is untrue, as smoking in general has a negative impact on the lungs. As studies yield mixed results regarding the protective and anti-carcinogenic properties of cannabis, a portion of the community interprets it as smoking cannabis is good for the lungs, when in reality it is just as bad as smoking tobacco. Risk of respiratory effects from inhaling cannabis smoke are heightened by the more intensive way in which cannabis is smoked. When smoking cannabis compared to tobacco, there is a prolonged and deeper inhalation, and it is smoked at a higher combustion temperature, which basically means that they're smoked in joints that go up to a very high degree Celsius. This results in approximately 5 times the carbon monoxide concentration, 3 times the tar, and the retention of 1/3 more tar in the respiratory tract. Higher level of ammonia and hydrogen cyanide, which are both very bad for your body, have also been found in cannabis smoke compared to tobacco, according to the Alcohol and Drug Abuse Institute of Washington University. Inhaling the smoke of burnt cannabis is irritating to the lungs and leads to more cases of chronic bronchitis. Any link between smoking cannabis and respiratory cancer is still being investigated. For more information about cannabis and respiratory health, I recommend the Canadian Centre on Substance Abuse article called Cannabis Respiratory Effects Reports.
Other interviewees got it right though. Cancer, pulmonary embolism, flus, and bacterial infections are all harmful things to your respiratory system. We will go more in depth about the different respiratory diseases you can get. To keep your respiratory system nice and healthy, exercising, hiking, refraining from smoke in its many forms, washing your hands to prevent infection, and drinking plenty of water are all beneficial. We will outline 5 different ways you can keep your lungs healthy later. The thing you shouldn't do to protect your lungs is smoke cannabis, though.
Next, we will talk more in depth about the respiratory system.
If you're just tuning in, you're listening to A Sound Constitution on 101.7 CHLY, where we're discussing the respiratory system. So, let's take a minute to discuss what the respiratory system does and why it's vital to our lives. The purpose of the respiratory system is to provide oxygen to our cells and get rid of carbon dioxide. Most people who have a general overview of human biology know that oxygen is very important to our cells for them to function properly.
If you've ever taken a first aid course, you've probably heard of the ABCs. After making sure that the area is safe, during an emergency situation, you assess the person for airway, breathing, and circulation, A, B, and C. The first 2 things you look for in an emergency are related directly to whether or not the respiratory system is functioning or not. But why is breathing so important? Why do you die so fast, approximately 4 to 10 minutes, when this function stops?
As living beings, we need energy to move, live, and function. We do this by eating and by breathing. We eat to obtain products like sugars and amino acids, which our cells need, but we need oxygen to be able to access the potential energy that we get from food.
Oxygen enables a process called cellular respiration. This is how our body uses the energy given to us by the food. Oxygen is used to help activate muscles and also help move certain materials in and out of cells. We can use other methods to create energy, but they are a lot more harmful to the bodies and are not very sustainable long term. They deplete very, very fast. Mm-hmm. You may have experienced this when you are doing very hard exercise. Because of the demands of your muscles are too much for the heart to meet, the body switches to anaerobic metabolism, or airless respiration, which causes the waste product lactic acid. This causes a cramping feeling and fatigue. I definitely get that whenever I'm running for a while. Mm-hmm. It's like my muscles just feel like they're just against me, you know?
Yeah, and it starts hurting. Last week we talked about the cardiovascular system, and that system is very relevant to this process as well, as the oxygen in your body is transported through the cardiovascular system. So then when the respiratory system fails, there are similar repercussions as a failure in the cardiovascular system. When you can't get enough air or oxygen, the cells in your body cannot perform their normal functions. The vital organs will stop performing their functions as well, and if oxygen is not restored, it will cause cellular death and eventually body death.
The functioning of the system is relatively simple to understand. Your diaphragm contracts and tightens to start the process of breathing in. As the diaphragm shrinks and contracts, other respiratory muscles at the sides pull outwards, which all result in the space where your lungs are getting bigger. Your lungs are expandable and are also very tightly stuck to the sides of the chest. So when the space gets bigger, your lungs gets bigger too. This causes a pressure shift and pulls air in from the outside of your body to the inside to fill up the extra space.
The air travels through your nose usually, which is equipped to trap any harmful bits in the air, warm up the air, and add moisture to the air. Your mouth is less effective at these jobs, which is why you may find your throat drying out with extended periods of breathing through your mouth.
The next step in the journey is the pharynx and the larynx, which you just need to remember as the upper respiratory tract. The upper respiratory tract is lined with tiny hairs that trap dust particles and other bits that have made it past your nose. There is more moisturizing happening here too, which helps the particles that were caught congregate and get pushed up by your esophagus and digestive tract. Your stomach is a lot better equipped to deal with these invaders than your lungs are.
The air then makes it to the lower respiratory tract, where it gets pulled down branching tubes into tiny air balloons in the lungs. These are connected to tiny capillaries where blood is flowing past. There is little oxygen in the blood that's flowing by, so oxygen flows readily into the blood from the lungs. There's also a lot of carbon dioxide in the blood because it's been collected from all over the body, and the carbon dioxide is also happy to move to an area where it's not so crowded, the air in the lungs.
Then the diaphragm expands and the respiratory muscles contract, making the lung space smaller and forcing the air back out into the environment. Then we do it all over again, day after day for our whole lives. Except when you become aware of your breathing and suddenly you have to go on manual mode.
Yeah.
And you're like, how do I put it back on automatic? Now I have to control my breathing.
So that's how the system works when everything is going good. But what about when things aren't going so good? What are some diseases that can affect lung health? And how does our environment affect the health of our lungs?
Let's talk about respiratory emergencies. Imagine a time when you've experienced struggling for a breath of air for a moment. Perhaps you stayed underwater for a bit too long, ran too fast, were breathing in noxious fumes, or were choking on something. When we are in this situation, it turns on a primal instinct to try your hardest to breathe, everything else failing in priority. All your body can focus on is just trying to get that next breath happen.
Your body generally has enough energy stored to last a little while. After that, it begins to descend into cell non-functioning and death. The most vital organ, the brain, starts to die after 4 to 6 minutes without oxygen. It lasts longer than the other organs because it's very greedy and steals as much oxygen as it can from the rest of the body for as long as it can. It's a smart thing for your brain to do though, because once the brain is dead, there's nothing that we can do to bring it back. The brain will fully die after 10 minutes without oxygen.
Everyone has probably seen at least one movie with CPR in it. Pounding on the chest, followed by breathing into the person's mouth, is the first steps of CPR.
I used to be curious about what good that did, seeing as we exhale carbon dioxide. If you're curious about this as well, then I hope you learned something good here today. Normal air has about 25% oxygen in it. However, when we breathe that in, we don't use all of it. Our gas exchange doesn't need it all, and that doesn't even include the air that never reaches the alveoli, the air that sits in the parts of your lungs and throat that doesn't do the gas exchange. As a result, the air you exhale contains about 16% oxygen, which is enough to be beneficial to a person who is currently breathing 0% oxygen without your intervention.
Next, we're going to be talking about 5 ways to keep your lungs healthy, and we'll go into more depth with each one. We're getting this information from the American Lung Association. You can check them out online. So the first way to keep your lungs healthy is to not smoke. Smoking cigarettes increases your chances of getting lung cancer and COPD dramatically. It also increases chances for heart disease, stroke, and infertility in women. Cigarette smoke narrows the airway passages and increases mucus production, making breathing more difficult. Chronic smoking can cause swelling in the lungs, and the swelling can even become chronic too, which means that it doesn't go away. Over time, cigarette smoke destroys lung tissues and may trigger changes that grow into cancer. The American Lung Association also stresses that even if you have been smoking for years, it's never too late to stop. Even if you've been smoking for years on end, just stopping for a day, you already feel a little bit better. After a week, you start smelling things, your chances of getting all these diseases goes down drastically, and if you keep having a sober life without any cigarettes, your life quality will become better and your life expectancy will be longer.
Cannabis smoking, as we discussed earlier, is just as harmful as tobacco smoking. On the Center for Disease Control and Prevention website, you can find many effective treatments to help you stop smoking. Here are a few. Talk to your doctor. Even 10 minutes will give you all the information and advice you may need.
The second one is individual, group, or phone counseling. There's lots of free options in the area. There's also North American initiatives that are available. We'll go into more resources later as well.
Yeah, sometimes having other people who have the same goal as you and are going through the same struggles can be very helpful in motivating you to continue.
The last effective treatment that the website outlines is nicotine replacement products such as nicotine patch, gum, and lozenges, which are all over the counter. And you can also get prescription non-nicotine medications from your doctor. We always recommend to just go to your doctor to talk about any kind of concerns you might have. If you've been smoking and you feel like it's been affecting your respiratory health, please go talk to your doctor. They will try to help you quit or get your lungs in a better shape.
Some helpful resources if you are thinking about quitting or just need to talk to someone. 1-800-QUIT-NOW is a free telephone support service that can help people who want to stop smoking or using tobacco. You can also get free help online on the CDC's Smoking and Tobacco Use website.
Another way to keep your lungs healthy is to avoid exposure to pollutants. This includes secondhand smoke, outdoor air pollution such as carbon monoxide from airs, chemicals in the home and workplace such as nitrogen dioxide and radon. Make sure your home and car are smoke-free, and make sure to test your home for radon. Even if you smoke regularly, it is recommended to not do it in a place where there's children and not in your own home, because it will just cling to the walls, it will stay in the air, and you will just be constantly subjected to toxic fumes into your lungs.
Yeah, step outside and make sure the extra smoke gets carried away, and that'll be safer.
And when there's bad air days, like a few weeks back when we had the huge forest fires all over BC, and the sky was just filled with smog and just disgusting air, don't exercise outside. And if you are elderly or a child, just try to limit your time being outside.
Yeah, the other thing is if you also have a current respiratory condition, so it's such as COPD and asthma, I mean, you're probably going to feel it if you go outside, but yeah, just recommend to limit your activity, stay inside, and avoid breathing in that air. If you're just tuning in, you're listening to A Sound Constitution on 101.7 CHLY, where we're talking about the respiratory system.
So preventing infections, it also contributes to healthy lungs. Colds and other respiratory infections can sometimes become very serious. To protect yourself, remember to wash your hands often, avoid large crowds during the cold and flu season, and keep good oral hygiene. The Lung Association also recommends getting vaccinated yearly for influenza, which can lead to pneumonia.
The most important rule to remember, though, is that if you're sick, keep it to yourself. Take the day off from work or school if you think you're sick, and keep your loved ones at a distance. By doing this, you are reducing their chances of them getting your sickness.
Getting regular health care is another way to make sure that you're healthy. Regular checkups help prevent diseases, even when you're feeling well. This is especially true for lung disease because it usually goes unnoticed and undetected until it is serious, but doctors can detect it by just checking your lungs. And it's very non-invasive and it's very quick as well.
We'll talk later about some risk factors that should motivate you. Like if you have these, you should go in for a checkup. We'll talk about that later. And last but not least, exercise. This was also mentioned in your Opinion Matters segment as a way to keep your lungs healthy, and they're completely right. Aerobic exercise help improve your lung capacity, which is how much air you can take in with each breath. This makes things like going a long distance, going up a few flights of stairs, or short distance running to the bus easier and leaves you less out of breath. Specific breathing exercises can also improve your lung function if you have COPD or other certain lung diseases. One other thing that could affect is lying down for long periods where you're not breathing very much, you're not getting much exercise, can also put you at risk for developing pneumonia as fluid may start building up in your lungs. So deep breathing exercises really help clear out any little pockets that might be forming there and really help protect you. If you've been lying down for a while, you're bedridden, you're in the hospital, it's really recommended that you do deep breathing exercises to help prevent further infection.
And we're going to talk about those a little bit later, and I'll teach you to do one of them. So breathing exercises can also reduce your stress level. And when you're stressed out, your body is in a fight or flight mode, basically ready to either run away from danger or fight an oncoming predator. According to the American Psychological Association, stress impacts all systems of your body. Your muscles tense up, your heart rate and blood pressure goes up, your glands release stress hormones, and you eat much more or much less than normal. And so much more that happens in your body. With respect to your respiratory system, stress can make you breathe harder. This is usually a problem for people with asthma or lung disease, such as emphysema. Reducing your stress level is incredibly beneficial for the body. You can never reduce your stress levels too much. You can do so by doing some breathing exercises. Even simply taking one big breath like this makes you feel better already. When you're relaxed, your breaths are slow and deep. By exercising deep breathing, you're letting your body know to relax. Just chill, man. Reduce your stress throughout the body. Here is one of the breathing exercises that HealthlinkBC recommends. Belly breathing is really easy to do and very relaxing. You can try this basic exercise anytime you need to relax or relieve stress. So the first step is to sit or lie flat in a comfortable position. Next, you put one hand on your belly, just below your ribs, and the other hand on your chest. Take a deep breath through your nose and let your belly push your hand out. Your chest should not move. Breathe out through pursed lips as if you were whistling. Feel the hand on your belly go in and use it to push all the air out. Do this breathing 3 to 10 times and take your time with each breath. And after you're done, notice how you feel at the end. After you've mastered belly breathing, you may want to try one of the most advanced breathing exercises. Try all 3 and see which one works for you. The 3 that are outlined on healthlinkbc.ca under stress management and breathing exercises for relaxation, you can try 4-7-8 breathing, roll breathing, or the morning breathing.
So, we've discussed how your respiratory system works and how to treat your respiratory system well. But now let's talk about some common conditions that affect this system. In the Your Opinion Matters segment, some of the things that people said can harm the system are viruses, bacterial infections, cancer, and someone even talked about a pulmonary embolism that they had. These are all correct as things that can harm the lungs.
Let's start with lung cancer. Cancer is when a certain cell in your body mutates and starts growing out of control and causes damage to your body because of uncontrolled growth. This is usually suppressed by the immune system already, but sometimes it fails, of course. Lung cancer is when the cells that are mutated are from your lungs. As the public has been made well aware, smoking is a major cause of lung cancer. According to the American Lung Association, men who smoke are 23 times more likely to develop lung cancer, and women who smoke are 13 times more likely. It has been estimated that active smoking is responsible for close to 90% of lung cancer cases. Radon causes 10%, and occupational exposures to carcinogens account for approximately 9 to 15%, and outdoor air pollution only 1 to 2%.
If you're paying attention and are passable at math, you may have noticed these percentages don't quite add up. This is due to interactions between exposures. It means the combined attributable risk for lung cancer can exceed 100%.
This basically means that because people sometimes they smoke and are also exposed to, car pollution or workplace
like asbestos.
Pollutants. Exactly. And you can't really separate which attribute contributed to the lung cancer because they have been exposed to all of these ones.
Mm-hmm. For instance, smoking asbestos workers are 50 times more likely to develop lung cancer compared to 5 times more likely for non-smoking asbestos workers.
Lung cancer can also be really deadly. Like 26% of all cancer deaths in Canada in 2017 were due to lung cancer. And the 5-year survival rate for lung cancer is lower than any other cancer that you can get.
And now for some good news.
Since 1980, the number of lung cancer cases in males has been steadily declining and has been slightly declining in women since 2006. This correlates with the change in the amount of smoking in these populations. It's never too late to quit smoking and decrease your chance of lung cancer. Even stopping, if you've been smoking for years, it really, really, really lowers your chance.
I definitely started noticing that in our generation, because of all the health promotion initiatives that have been happening in the United States and Canada, smoking in people, like 20 years old, they're less likely to be smoking, unlike their counterparts of the older generations where they've been exposed to advertisements that glorify smoking almost. This also happens currently in China and Japan, where smoking is very much a cultural thing, and hopefully we will see the results that are happening in North America replicated throughout the world in terms of smoking.
To detect lung cancer early, the Canadian Cancer Society recommends getting screened once a year if you're at risk. At-risk individuals are people who are 50 to 74 years of age. Evidence shows that screening is most effective for people in this age group. People who are current smokers or former smokers who quit in the past 15 years, and people who have smoked 30 pack years, which is defined as 1 pack a day for at least 30 years or 2 packs a day for 15 years. It's important to note that smoking isn't just limited to cigarettes. Smoking any tobacco product, such as a pipe or cigar, still gives you the same risk.
Those are the recommendations for official screenings, but if you have a personal or family history of lung cancer, have been exposed to a lot of secondhand smoke, live in an area with high radon levels, or live in an environment that is high in asbestos, arsenic, or diesel exhaust, or are concerned for whatever reason, make an appointment with your doctor. You can discuss your concerns and get tested, or get personalized test schedules that are appropriate for you. We've talked about cancer in past episodes, and we're not going to go into specific treatment here, but we hope that you've learned something from this section and are more informed about your risk of getting lung cancer.
The next lung condition that we're going to discuss is a pulmonary embolism. One of the people we interviewed mentioned her experience with a pulmonary embolism, and perhaps you've heard of the term. A pulmonary embolism is comparable to a heart attack in that it's a clot in your circulatory system that gets lodged in your lungs and cuts off the blood flow to a certain area, just like a clot can block off certain areas of your heart and cause damage there. Like a heart attack, a pulmonary embolism can be deadly, though the majority of them are less severe and simply damage a portion of lung tissue.
According to HealthlinkBC, the symptoms of a severe pulmonary embolism are sudden shortness of breath, a sharp chest pain that is worse when you cough or take a deep breath in, and a cough that brings up pink, foamy mucus. It is very common for the clot to get lodged in the lungs to come from the legs. Because of this, anything that puts you at risk of developing clots also increases your chance of getting a pulmonary embolism. Things that can increase your risk include being inactive for a long period of time. This means that when you have to stay in bed after a surgery or a serious illness, or when you sit for a long time, like on a flight or a car trip. You may see some people wearing tight socks on plane trips, and this is to prevent clots from forming in their legs.
Recent surgery that involved the hips, legs, belly, or brain can also put you at risk for pulmonary embolism.
Some diseases, such as cancer, heart failure, and stroke, or some kind of severe infection, also increase your risks of getting a pulmonary embolism.
Pregnancy and childbirth, especially if you've had a cesarean section.
Taking birth control pills or hormone therapy.
And smoking.
You're also at higher risk for blood clots if you are an older adult, especially older than 70, or extremely overweight.
The next thing we're going to discuss are respiratory conditions that many people experience: colds, flu, bronchitis, and pneumonia. Let's first outline the differences between them. The flu is an infection of the nose, throat, and lungs caused by an influenza virus. Often it just leaves you feeling lousy, but in the old, young, immunocompromised, and those with chronic lung disease, the flu can be more life-threatening. Today we have yearly vaccines for the flu that are given to the populations most at risk at getting or spreading the infections.
Another thing that I wanted to just add real quick, because this is a viral infection, taking antibiotics does not help at all. Actually, it's a very big problem for people to be taking antibiotic medication for viral infections because it increases the bacteria that's resistant to the antibiotics. So if you ever get a bacterial infection and they treat you with antibiotics, it might not be very...
Like the bacteria might have developed a resistance to it because you've used it unnecessarily. Like we really want to save antibacterial medication for when you need to use it so that you don't create the resistances unnecessarily.
A cold, on the other hand, is a respiratory illness that can be caused by viruses or bacteria that is often milder than the flu. Where a flu will give you a temperature, a mild to severe cough, headache, chills, muscle aches, and will come on quickly. A cold will rarely have a fever, have a mild cough, and mostly have runny and stuffy nose and has a gradual onset. We've all had it before, so we know how it is. In fact, 'tis the cold season, and I am currently suffering from a cold right now. Don't worry, I'm making sure to sanitize everything and drink lots of water.
Bronchitis is more serious still. It's sometimes referred to as a chest cold and occurs when the airways in your lungs become inflamed and very mucousy. You can have acute bronchitis or chronic bronchitis. That is, bronchitis that's a singular occurrence or bronchitis that keeps coming back year after year. Smoking makes bronchitis worse and is the leading cause of chronic bronchitis. Bronchitis symptoms are a cough that is frequent and produces mucus, and you may or may not have a wheezing sound when breathing or a fever.
Ain't nobody got time for that.
Pneumonia can come from bronchitis. Pneumonia is the infection that inflames the air sacs in your lungs, called the alveoli. Your lungs can fill with fluid, impeding air exchange. Pneumonias can be bacterial, viral, or fungal. Pneumonia can be mild or severe and have symptoms that include chest pain when you breathe or cough, confusion or changes in mental awareness in adults ages 65 or older, cough which may produce phlegm, fatigue, fever, sweating and shaking, chills, and more symptoms. To prevent pneumonia, stay up to date with vaccines, wash your hands, and don't smoke, as well as follow the guidelines that we've outlined earlier to keep your lungs healthy.
I just wanted to take a moment here to talk about vaccines some more. There's a popular belief that vaccines are unnecessary and harmful. This is not true. Many scientists, doctors, and healthcare professionals have proven many times that vaccines are safe and beneficial. Experts in their field, looking for the best interests of the health of people with years of research, study, knowledge, and experience. These people have looked into this and concluded that they are necessary, and although there's a slight chance that a small number of people may react to it, it's well worth the risk to protect yourself. Some of the vaccine-preventable diseases that are specifically related to respiratory system are the strains of influenza, diphtheria, pertussis or whooping cough, tuberculosis, and pneumococcal infection.
Now let's have a music break. After, we will hear the fantastic story of Charity Tillman-Dick and her fight with the lung disease that put everything on the line. But first, here is Breathe by Moist.
Save me from this. Wandered round the town, all the thousand things I might miss. all the friends we've known say goodbye. And did you suffer much? Did you close your eyes just to see the night rush on by? Gathered all around you, hoping we don't let you down again. Said I'm so glad to be here. Does it mean anything? If only I could breathe what you breathe. If only I could see what you see. Said I'm so glad to be here. Does it mean a thing? Said I'm so glad to be here. Does it mean a thing? Yeah, I'm so glad to be here. Does it mean anything? If only I could breathe what you breathe. If only I could see what you see. If only I could just believe a thing.
That was Breathe by Moist. If you're just tuning in, you're listening to A Sound Constitution on 101.7 CHLY. We're talking about the respiratory system. Next, we'll hear a TED Talk by Charity Tillman-Dick. She's a soprano who has appeared on opera and concert stages around the world. In her talk, she tells a double story of survival, of her body from a double lung transplant, and of her spirit, fueled by an unwavering will to sing.
You may not know this, but you are celebrating an anniversary with me. I'm not married, but 1 year ago today, I woke up from a month-long coma following a double lung transplant. Crazy. I know. Insane. But thank you. 6 years before that, I was starting my career as an opera singer in Europe when I was diagnosed with idiopathic pulmonary hypertension, also known as PH. It happens when there's a thickening in the pulmonary veins, making the right side of the heart work overtime and causing what I call the reverse Grinch effect. My heart was 3.5 sizes too big. Physical activity becomes very difficult for people with this condition, and usually after 2 to 5 years, you die. I went to see this specialist, and she was top of the field and told me I had to stop singing. She said those high notes are going to kill you. Well, she didn't have any medical evidence to back up her claim that there was a relationship between operatic arias and pulmonary hypertension. She was absolutely emphatic. I was singing my own obituary. I was very limited by my condition physically, but I was not limited when I sang. And as air came up from my lungs through my vocal cords and past my lips as sound. It was the closest thing I had ever come to transcendence. And just because of someone's hunch, I wasn't going to give it up. Thankfully, I met Retta Gerges, who is dry as toast. But he and his team at Johns Hopkins didn't just want me to survive. They wanted me to live a meaningful life. This meant making trade-offs. I come from Colorado. It's a mile high, and I grew up there with my 10 brothers and sisters and 2 adoring parents. Well, the altitude exacerbated my symptoms. So I moved to Baltimore to be near my doctors and enrolled in conservatory nearby. I couldn't walk as much as I used to, so I opted for 5-inch heels. And I gave up salt, I went vegan, and I started taking huge doses of sildenafil, also known as Viagra. My father and my grandfather were always looking for the newest thing in alternative or traditional therapies for PH, but after 6 months, I couldn't walk up a small hill, I couldn't climb a flight of stairs, I could barely stand up without feeling like I was going to faint. I had a heart catheterization where they measure this internal arterial pulmonary pressure, which is supposed to be between 15 and 20. Mine was 146. I like to do things big. And it meant one thing. There is a big gun treatment for pulmonary hypertension called Flolan. And it's not just a drug, it's a way of life. Doctors insert a catheter in your chest, which is attached to a pump that weighs about 4.5 pounds. Every day, 24 hours, that pump is at your side administering medicine directly to your heart. And it's not a particularly preferable medicine in many senses. This is a list of the side effects. If you eat too much salt, like a peanut butter and jelly sandwich, you'll probably end up in the ICU. If you go through a metal detector, you'll probably die. If you get a bubble in your medicine because you have to mix it every morning and it stays in there, you probably die. If you run out of medicine, you definitely die. No one wants to go on Flolan. But when I needed it, it was a godsend. Within a few days, I could walk again. Within a few weeks, I was performing. And in a few months, I debuted at the Kennedy Center. The pump was a little bit problematic when performing, so I'd attach it to my inner thigh with the help of a girdle and an ace bandage. Literally hundreds of elevator rides were spent with me alone, stuffing the pump into my Spanx, hoping the doors wouldn't open unexpectedly. And the tubing coming out of my chest was a nightmare for costume designers. I graduated from graduate school in 2006, and I got a fellowship to go back to Europe. A few days after arriving, I met this wonderful old conductor who started casting me in all of these roles. And before long, I was commuting between Budapest, Milan, and Florence. Though I was attached to this ugly, unwanted, high-maintenance mechanical pet, my life was kind of like the happy part in an opera. Very complicated, but in a good way.
If you're just tuning in, you're listening to A Sound Constitution on 101.7 CHLY, where we're listening to a TED Talk by Charity Tillman Dick about her experience with a double lung transplant.
Then in February of 2008, my grandfather passed away. He was a big figure in all of our lives, and we loved him very much. It certainly didn't prepare me for what came next. 7 weeks later, I got a call from my family. My father had been in a catastrophic car accident, and he died. At 24, my death would have been entirely expected, but his, well, the only way I can articulate how it felt was that it precipitated my medical decline. Against my doctor's and family's wishes, I needed to go back for the funeral. I had to say goodbye in some way, shape, or form. But soon I was showing signs of right heart failure, and I had to return to sea level. Doing so knowing that I probably would never see my home again. I had canceled most of my engagements that summer, but I had one left in Tel Aviv, so I went. After one performance, I could barely drag myself from the stage to the taxi cab. I sat down and felt the blood rush down from my face. And in the heat of the desert, I was freezing cold. My fingers started turning blue, and I was like, what is going on here? I heard my heart's valves snapping open and closed. The cab stopped, and I pulled my body from it, feeling each ounce of weight as I walked to the elevator. I fell through my apartment door and crawled to the bathroom. Where I found my problem, I'd forgotten to mix in the most important part of my medicine. I was dying. And if I didn't mix that stuff up fast, I would never leave that apartment alive. I started mixing, and I felt like everything was going to fall out through one hole or another, but I just kept on going. Finally, with the last bottle in and the last bubble out, I attached the pump to the tubing and lay there, hoping it would kick in soon enough. If it didn't, I'd probably see my father sooner than I anticipated. Thankfully, in a few minutes, I saw the signature hive-like rash appear on my legs, which is a side effect of the medication, and I knew I'd be okay. We're not big on fear in my family, but I was scared. I went back to the States, anticipating I'd return to Europe, but a heart catheterization showed that I wasn't going anywhere further than a flight for life from Johns Hopkins Hospital. I performed here and there, but as my condition deteriorated, so did my voice. My doctor wanted me to get on the list for a lung transplant. I didn't. I had two friends who had recently died, months after having very challenging surgeries. I knew another young man, though, who had PH, who died while waiting for one. I wanted to live. I thought stem cells were a good option, but they hadn't developed to a point where I could take advantage of them yet. I officially took a break from singing, and I went to the Cleveland Clinic to be reevaluated for the third time in 5 years for transplant. I was sitting there kind of unenthusiastically talking with the head transplant surgeon, and I asked him if I needed a transplant, what I could do to prepare. He said, "Be happy. A happy patient is a healthy patient." It was like in one verbal swoop, he had channeled my thoughts on life and medicine and Confucius. I still didn't want a transplant, but in a month, I was back in the hospital with some severely edemic cankles, very attractive, and it was right heart failure. I finally decided it was time to take my doctor's advice. It was time for me to go to Cleveland and to start the agonizing wait for a match. But the next morning, while I was still in the hospital, I got a telephone call. It was my doctor in Cleveland, Marie Boudev, and they had lungs. It was a match. They were from Texas. And everybody was really happy for me, but me, because despite their problems, I'd spent my whole life training my lungs, and I was not particularly enthusiastic about giving them up. I flew to Cleveland, and my family rushed there in hopes that they would meet me and say what we knew might be our final goodbye. But organs don't wait, and I went into surgery before I could say goodbye. The last thing I remember was lying on a white blanket, telling my surgeon that I needed to see my mother again, and to please try and save my voice. I fell into this apocalyptic dream world. During the 13-and-a-half-hour surgery, I flatlined twice. 40 quarts of blood were infused into my body. And in my surgeon's 20-year career, he said it was among the most difficult transplants that he's ever performed. They left my chest open for 2 weeks. You could see my oversized heart beating inside of it. I was on a dozen machines that were keeping me alive, and infection ravaged my skin. I had hoped my voice would be saved, but my doctors knew that the breathing tubes going down my throat might have already destroyed it. If they stayed in, there was no way I would ever sing again. So my doctor got the ENT, the top guy at the clinic, to come down and give me a surgery to move the tubes around my voice box. He said it would kill me. So my own surgeon performed the procedure in a last-ditch attempt to save my voice. Though my mom couldn't say goodbye to me before the surgery, she didn't leave my side in the months of recovery that followed. And if you want an example of perseverance, grit, and strength in a beautiful little package, it is her. 1 year ago, to this very day, I woke up. I was 95 pounds. There were a dozen tubes coming in and out of my body. I couldn't walk, I couldn't talk, I couldn't eat, I couldn't move. I certainly couldn't sing. I couldn't even breathe. But when I looked up and I saw my mother, I couldn't help but smile. Whether by a Mack truck or by heart failure or faulty lungs, death happens. But life isn't really just about avoiding death, is it? It's about living. Medical conditions don't negate the human condition. And when people are allowed to pursue their passions, doctors will find they have better, happier, and healthier patients. My parents were totally stressed out about me going and auditioning and traveling and performing all over the place, but they knew that it was much better for me to do that than be preoccupied with my own mortality all of the time. And I'm so grateful they did. This past summer, when I was running and singing and dancing and playing with my nieces and my nephews and my brothers and my sisters and my mother and my grandmother in the Colorado Rockies, I couldn't help but think of that doctor who told me that I couldn't sing. And I wanted to tell her, and I want to tell you, we need to stop letting disease divorce us from our dreams. When we do, we will find that patients don't just survive, we thrive. And some of us might even sing. Je veux vivre dans ce rêve qui m'enivre ce jour encore douce flamme. Je te garde dans mon âme comme mon trésor. Je veux vivre dans ce rêve qui m'enivre ce jour encore douce flamme. Je te garde dans mon trésor. Loin de l'éveil la rose, laissez-moi sommeiller et respirer la rose, respirer la rose avant de la feuiller. Douce flamme.
What a beautiful story. It is a very true show of resilience in her case, which is the capacity to recover quickly from difficulties. Her singing at the end is just absolutely beautiful, and it's a perfect place for our show to end. Here are some resources that we mentioned earlier in this show. For breathing exercises, go to healthlinkbc.ca and search for stress management, breathing exercises for relaxation.
To get help for smoking cessation, text "Quit Now" to 654321 or go to quitnow.ca. You can also talk to your doctor about the BC Smoking Cessation Program.
For more information about smoking cessation from our healthcare provider, go to islandhealth.ca and search for Lung and Respiratory Health.
For more information about the respiratory effects of cannabis smoking, I recommend the Canadian Centre on Substance Abuse article called "Clearing the Smoke on Cannabis." Tune in next week for our show on the digestive system.
Thanks for listening to Sound Constitution on 101.7 CHLY.
Look for us on Facebook and Instagram.
Or check us out on YouTube for previous shows.
Tune in next Thursday from 10 to 11 for more from A Sound Constitution.
Bye for now.